Hi, everyone. It looks like a lot of you are starting to sign on. While you're signing on, we'd love it if you could chat in the names of the folks who are in the room with you and their credentials, too. So whether they're an RN or an MA or anything like that. We'll get started right at 12, but yeah, please chat in who's in the room with you. Okay, we're going to unmute ourselves because we're having fun looking at who all is logging in because we recognize a lot of your names from old tips people. So far we think the person logging in from the furthest distance. Oh, and now there's so many of you listening to directions, I think it's going to be hard for me to find it. There, Lisa Tungovia from Hopi Health. I think that's the one I've seen from the furthest away.
That's the furthest so far.
Yeah. Oh, welcome Lucy, who works for Head Start. What a great partner. Here to learn about vaccines. And we're getting lots of folks saying, yes, we hear you. So if you're just joining us, please, we're going to get started here in a minute, but go ahead and use that chat feature to tell us the names and the credentials of the folks who are in the room with you so that we can count you later. And it's fun. I feel like we should have reserved 5 minutes to just call off our friends' names. Because it's fun to see you all. But, well, we will get started. And again, if you're just logging on, it looks to be, there's 227 of us already logged onto this from throughout Arizona. And please chat in the names and the credentials of the folks who are in the room with you. So, my name is Rebecca Nevedale, and I'm with TAPI.
And hi, I'm Macrina Leach. I'm with Maricopa County Department of Public Health.
And Macrina is a nurse, so she's our clinical specialist for this. I'm just a regular person. I don't have credentials after my name, but we're both with TAPI and have been members of TAPI for a long time. One of us much longer than the other, but
that would be me.
But we love TAPI.
How old was I when you were born?
Well, it was 1983.
Oh, that's just awful. I'm not even going to say a word.
No. But she probably knows what vaccines I got. So TAPI is our state vaccine coalition. We are made up of all of you, our partners. We have over 400 coalition members, and a lot of you might be coalition members or work for organizations who are. So we have health plans, we have pharmaceutical companies, schools, medical practices, medical associations, anybody who cares about making sure that Arizonans are vaccinated and who are passionate about vaccines. And we work together to improve outcomes and have been doing so since 1993. So I was alive then. And you were there at the beginning of TAPI.
I was there at the beginning of TAPI, yep.
Yeah, so lots of folks have been doing this work for a long time. And we are really lucky today to have Dr. Colleen Marias, who is actually on the board of directors for TAPI. And Dr. Marias, will you kind of kick us off and say welcome to everybody?
I am happy to. Thank you to everybody for joining us today. This is our first TIPS training of 2020, and we're so pleased that so many of you are here. My name is Colleen Marias. I am a practicing pediatrician as well as the pediatric section head for Cigna Medical Group here in Maricopa County. As a member of the TAPI Steering Committee, I welcome you all to today's meeting. I know firsthand how challenging your jobs are right now. COVID-19 has shown us that a virus without a specific treatment or a targeted vaccine can turn all of our lives upside down. I also know that we must continue to do our best to take care of our patients and to work to keep Arizona's children, adults, and families healthy. For those of you who have attended TIPS training in the past, you will see that we have changed to an online format, but we have not changed the content of our training. Our preference obviously is to come to you and learn from your experience in your community, but that's not practical right now. For those who are joining us for the first time, we are offering the same high quality training virtually to allow you to be up to date, informed, and prepared to deliver the very best care you can to the patients that entrust their health care to you. Please engage with us today in the learning process by jumping into the dialogue and sharing the day-to-day challenges that you face with the excellent training team here. Our training today is designed to give vaccine coordinators, medical assistants, and clinic staff the very best tools to manage vaccines. Your jobs right now are critically important. When you understand the process of building trust with your patient families and help them feel comfortable with vaccinating their children, you give them the gift of a lifetime, immunity to preventable diseases. I have seen the value of this training to our own Cigna pediatric staff members in the clinics that I supervise. We have received outstanding practice awards by following the guidelines that you will learn starting today. Congratulations to everybody on taking the initiative to join us today.
Thank you. That was great. You know, we do travel throughout Arizona most summers, Macrina and I, or another public health nurse, and we are really sad that we're not doing that this year for a lot of reasons, but we just learned so much from you all when we get to hear what you do in your communities, and you know your patients so well, and you know your community so well. Plus, almost everywhere in Arizona is cooler than Phoenix in July and August, so we are also missing being able to be in the cool weather. But we're just so inspired by what you do every day, and you save lives every day, right?
Well, and you do what is very hard to find people to do on a daily basis. I worked in the immunization clinic yesterday. I now know how hard it is to try to convince a mom that it's okay to get 5 immunizations at once. I know how hard it is to keep your VFC separate from your private purchase and maintain inventory. And I really miss being out there with all of you, because I learned just as much from you guys as I hope you learn from us, that I can bring back to the staff here at Maricopa County, that your little tricks of the trade that help make our lives a little bit easier. So hopefully next year we'll be on the road again.
Yeah, but it is such an honor to be able to be part of your journey to get the right information for you to provide to your patients so that they can make whatever decision they think is right for their family. But you, especially as medical assistants, and for those of you who've been to TIPS before, actually, let's go ahead, Chris, if we can launch that attendee poll right now. You'll see a poll pop up on your screen, and just select the option that best reflects, your answer. Just answer the question. It should be pretty easy about whether or not you've been to a TIPS before. But if you have, we love medical assistants, and we truly believe that the vaccine delivery system, you are the vaccine delivery system. And we love that we get to be part of giving you tips and tricks and helping you learn from each other about how to talk with those families. So we'll give you maybe just another minute here. And then Chris, whenever you think they're starting to slow down, you can go ahead and share our results. And Chris, who I'm shouting at, he works for the Arizona Telemedicine Program and HRSA's funded Southwest Telehealth Resource Center. And we are so happy to partner with them for this, because it makes it possible for us to continue providing TIPS training. Wow. So normally, and you can all see these results here, 44% of you are repeat business. Yeah. And over half of you haven't been here before. We hear all the time at the end of TIPS,
wow,
man, I wish the other MAs in my office could have came to this today. So this is great, because it looks like you have forwarded that to the other MAs in your office. So. And I think that it looks like we don't really need to go over too much of the technology. We're going to try really hard to keep this the same way TIPS has been before. We've just light and fun and conversational. We have learned over the years that if Macrina and I are just ourselves, you are yourself, and you ask your real questions, and we learn how we can support you in the training and then for the rest of the year. Plus, we make new friends who love vaccines, and we like to make new friends that use vaccines. So if you haven't figured out how to use that chat function yet, we hope that you will, you just kind of hover on your Zoom window there, and you can find it there. And we are asking that you chat in the names and credentials of people who are in the room with you. And Chris, can you launch this attendee poll too now? I think that's what it is, or people poll, or whatever I named it. Number poll. We're going to be asking you to do that, chat in the names of who's in the room with you at each of the 5 sessions. We need to know that so we know how many people we're reaching. We had 580 or so register today. Already 400 of you are logged on. So we will be monitoring that chat, but we will also be, we're winging it for this first one, right? So we're going to try to respond to all those questions that you post in, but we'll learn how to do that better for the next one. And Chris, whenever you're ready to show the results, we'd love to know too. So go ahead and chat in your questions. Treat this like it would be any other tip session. No questions are off limits, and we're really here to just make sure that you all get the information that you need to be able to educate families. All right. There we go. Okay, so one thing, the elephant in the room, right, is that we're in the midst of a pandemic, and you are really on the front lines of that pandemic, and we know that, and appreciate all that you're doing. We're, as public health workers, have also been very busy, and we did want you to know that Macrina and I have see each other quite a bit, and we are being really careful. Today, we are not 6 feet apart, and we're not wearing masks, but that's because we don't have mics in this room, and you wouldn't have been able to hear us otherwise. But we wanted to just make sure that you know we are doing our best to take care of ourselves. We would like to not be in your office for a sick visit. We only want to go in there for well visits. So we just wanted to make sure you knew that. But we also thought it might be helpful to spend a little bit of time in each of these sessions to talk about COVID-19. So I'm going to introduce Dr. Peggy Stemler, who's consulting with the Maricopa County Health Department on COVID response. And she's going to talk to us a little bit about COVID-19, and go ahead and chat in all your questions. If she doesn't get to answer them today, then we can make that our topic for the COVID-19 update in 2 weeks at our next tip session or something like that. So, and Peggy's my boss, so chat in nice things about me too, if you would like, but she is my real boss. All those people who've come here before Peggy have heard about you. All nice things.
Everything is always really nice. So you're seeing the slide, yes? Okay, so I'm going to talk just, I know you guys, this is maybe some of you may have been tracking this COVID-19 stuff really closely, and others of you may not. So this first time, we're just going to do some kind of here's what the situation looks like. So across the country, there's almost 2 million people who have had a test showing that they've had COVID-19 since the start of this whole thing. And over 110,000 people have actually died from it. Arizona is one of the places that does have one of the higher numbers of reported cases. And that's especially interesting because you see a lot of the really dark blue states that are really big population states, but Arizona is not a giant population state, which means that we are seeing kind of more disease here than some other places are seeing. So in Arizona, there's almost 30,000 cases reported. Now, this is data from the state health department, and they put on their website every day updates about what's going on. They report both the tests that are called the PCR test. That's kind of like your strep test, where when you get a positive, you know that it's a positive test. It's based on the virus genetic material, and it's pretty certain. And then probable cases, which are either there's a lot of different ways that those are defined, but those are defined pretty formally by the Centers for Disease Control, CDC. But that's some of that antibody testing that you may be hearing about, as well as just symptom complexes. So that's total overall. And what that looks like, those numbers are big, but what that looks like across Arizona is for every 100,000 people in Arizona, 415 people have been tested or probably had COVID-19 since the beginning of all of this in January. And a little over 1,000 people have died, and it's a little bit over 15 people out of 100,000. So it's a big deal right now, of course. And I think that the other thing is it's a bigger deal in some places than others right now. So on the left side of this slide, and again, this is data from the Department of Health Services, the State Department of Health Services, and they have the number of people who have tested positive or who are probable for COVID-19 just by the absolute number, and the dark red is the highest number. And of course, that's Maricopa County, but that should be a surprise to nobody because Maricopa County has the greatest number of people living in it. So on the right-hand side, when you adjust those cases again to this, like by a population, so it's a better way to look at what the proportion of people in any given county who test positive. And you see that in Arizona, the northeastern part of the state, particularly Navajo and Apache counties, and particularly, as we all, I think, know and are really sensitive to, Navajo Nation and Hopi land are really right now kind of the place where they have been the hardest hit by COVID-19 in Arizona. But we're also starting to see in the southwestern part of the state along the California border and in Nogales, Santa Cruz County, that those proportions are rising a little bit as well. And the state is tracking all of that very closely, of course. But these are some of the ways that you can sort of see where things are happening in Arizona.
Peggy, we have a question from Yolanda Kalfas is asking, are these numbers, increased numbers, due to more testing? And then Nancy Sather has a question about, do we have stats on school-aged children?
So in terms of the more testing, that's a tricky question because and I'll talk about that a little bit more later with a different way of looking, a different picture of the data. But there's definitely been more testing since the beginning because the amount of supplies has been more and more available. The PPE, the personal protective equipment like masks and gowns and gloves and everything is more available. But the numbers that you're hearing about in the news, and you'll see this a little bit later, aren't only due to the increase in testing. So these are the numbers that are from the beginning. What you see in this, and this is kind of a weird little chart, but I'm showing it mostly to show that the top line is those PCR tests, the ones that are the genetic material tests that are the ones that, like, when you're positive, you're definitely positive. And then the bottom line is the serology test antibodies, where we're not totally sure yet how to interpret those because these tests are so new, and what they're testing for is still kind of becoming more and more obvious with time. But the top line, those PCR tests, one of the things that you see is early on the left-hand side of all of those dots, that's when not very many tests were being taken. And if you were being tested, you probably had some symptoms that made people worry that you had COVID-19 and they wanted to test you. And early on, the percent positive, even under those circumstances, other than that sort of second little dot blip, was running around 5 to 7% over time. And then as you get kind of a little bit past halfway down that dot line, end of April, beginning of May was when the testing blitz started to happen across the state. And with the increased number of testing, the proportion of those tests that was positive was hovering around 5 or 6%. And what we're starting to see now is the testing blitz has been going on, went on for 5 weeks, 5 weekends, 5 Saturdays. So the most recent numbers really don't represent the testing blitz exactly, but tests are more available. But what we are seeing and what's more worrying is that despite more tests being out there, being available, more people are testing positive. So it takes a while from the time you get the test taken to the time that those results get reported in. So that May 3rd week, which is the last one where you see the taller gray bar, 12% of those tests were positive. So it had been running around 5 to 6%, and that's 12%. And that's one of the things that sort of supports that we're getting a little bit more community spread of COVID-19 in the state. And this is for all across the state here. Now, I am going to show some Maricopa County specific data, mostly because it's a chart that I couldn't find a good way to get that statewide or from other counties. But this one is just really to say, when people are talking about who's at higher risk for severe disease or dying from COVID-19, it's based on this information. And if you look at that very bottom line that says high risk, what that tells us is individuals who are 65 years of age or older, or individuals who have one or more chronic medical conditions are the people who are at most likely to be hospitalized, most likely to be admitted to ICU, and most likely to die of COVID-19. So that's where that comes from. The children, there was a question about children, and I don't have the specific age breakdowns here, but I can tell you where to get it and come back a little bit later. But that 0 to 19, the proportions in terms of all cases, there's not as much testing going on for them, but they're much less likely to need to be hospitalized or admitted to the ICU in general. So one of the questions, and again, this is Maricopa County data because it is something that I have access to in this form. That's why I wanted to use it. But there is a similar curve for all Arizona on the ADHS website. There's not different ones available by county. So I wanted to show you this county piece because this shows us with the different dates when the stay-at-home order was put in place at the end of March, and how we had, a rise in that black dotted line was sort of creeping up and creeping up and creeping up, and then it started to kind of settle out around mid-May, which was around and that was part of the timing for the governor to lift the stay-at-home order. What we see now, though, is that black dotted line is starting to rise again. When the black dotted line stops is when we are pretty confident that all the tests that were sent to the lab, the results got sent back in. What you see past that on the far right-hand side of this graph is that there are some pretty tall bars there. Those are positive tests, but we also are expecting additional tests to be reported in. So that dotted line is rising. So that is another indicator that we have community spread that's beyond just the impact of increased testing. So increased testing definitely showed us, you can see, in that middle of the chart when the lines kind of went up and then up and then up, that was results of the testing blitz, but we're getting way past that. The testing blitz is over and the positives are going up. The other thing that people watch, and this is just sort of information just so that you know what the data is that people are looking at, is who's been hospitalized. Early on, you had the best chance of getting a test was if you ended up in the hospital sick with the right symptoms, because tests were not widely available in the community, and that was really in that February, March period. And so this has been a pretty reliable way of looking at, we know that people who are in the hospital have been tested. And what we can see here is that black dotted line kind of went up pretty steeply at the beginning, and then has kind of plateaued out, evened out over time, and started actually to go down, which is really good news. This is only individuals who live in Maricopa County. So I'll talk about that in a second, but you see that that line is trending downward, and that's really great. But we also know that there's about a week or two from the time that we start getting that community spread for people who catch COVID and who are going to get sick enough to be in the hospital to kind of get that sick. So there's a lag time from the time you might test positive to the time that you get sick enough to maybe need to be in the hospital. This data is gathered by the county health department based on interviews. So there is still going to be more information come in as they're able to interview all the people that test positive. Now, what you're hearing, which is very real about hospital beds, you know, hospitals are getting more and more full, that's really quite true in Maricopa County, which this chart doesn't look like. It looks like the numbers are going down, but the beds are being filled up by people from across the state, because we all know that Maricopa County and Pima County have the largest number of hospital beds available and ICU beds. So people are being transferred in from other places. So that's where things are. That's just kind of a quick look at the data. But the most important thing that all of us can do is really just kind of keep being careful, right? You know we have to stop the spread of disease. The infection is still out there. We're going to talk more a little bit later about herd immunity. And for COVID-19, we don't have it yet. And we don't have a vaccine yet. So the most important things you can do is keep that distance between yourself and other people. So at least 6 feet of distance. Unless it's somebody that you're in the house with all the time because you kind of know what their symptoms are. If you're working in an office, like if you're at the front desk and you're checking people in, you've been at grocery stores where they have those plexiglass barriers put up. That's one way of protecting yourself and your staff and your team against having those airborne droplets being spread. Wear your cloth mask or a surgical mask if they have them at your office. Wear it all the time, except for when you're eating. And
or when you're presenting,
if you're out in,
when you're presenting,
right, or when you're, they're in their own little household. I think that's the way to look at it. And then keep washing your hands. And you know what? Honestly, this is stuff other than this idea that wearing masks, which is not something that we've done a lot in the U.S. at this point, but just keeping away from people. If it's cough and cold season, don't touch your face, wash your hands all the time, use that hand sanitizer. That's pretty common sense stuff. And you guys already know this, you do it, especially when you're in the middle of flu season. So just think of this as flu season multiplied. You know, treat it just like you would. You don't want to get sick taking care of other people. The other thing is if you're talking.
I think that we had, we weren't sure if folks were really going to want to hear about this, but judging by the number of questions we're getting in chat, I think that it has been really helpful. So we will look through all of these questions that you have in your chat, that you all have been chatting, and think about what to talk about for the next session. And then did you have anything about the webinars that are happening, at least in Maricopa County? A slide or something for that?
Yeah. I did not put that slide in here, but Maricopa County, and this is a poster for symptoms that you guys can think about at work, but we'll share that with you all overall. And again, this is just so important to say thank you to everybody who's out there being vaccinators. It is going to be so critical, both for flu this year, but also, of course, just keeping kids and people healthy. So we really love you guys. Thank you so much. You are our first line of defense.
Yes. Hug a Medical Assistant Day, as always, at TIPS. And Chris, can you launch that other poll that we have? We're interested in how you think that the COVID poll, I think that's what it's called, yes. How you think immunization coverage has been impacted by the COVID-19 pandemic. So do you think since the pandemic, coverage for the patients in your office has decreased? So normally you have more patients who are overdue right now. Has immunization coverage stayed about the same, or has it increased? Have you actually been able to immunize more patients during the pandemic than before it? And while you're answering that, we're going to move along. Thank you, Peggy, so much. I'm glad that people seem like they have tons of questions about this. Okay. So we're going to talk today about why vaccines are important and protecting herd immunity. Before we go there, we are going to, and whenever you can share that result, Chris, whenever you think it's slowed down enough, we'd love to see it. So it looks like most of you think that things have decreased. So after the session, there's an evaluation that we really want you all to complete, especially because this is our first time doing this virtually, and we really want to get your feedback on how to improve. But next, on June 24th at the next session, we're going to be talking about catch-up schedules. So any specific questions you have or tips to share or things you want us to review, make sure you put that on your evaluation. But for today, we're going to be talking about herd immunity and diseases. Yes, Macrina's favorite topic. So let's do a couple overview of a few terms first. So we know that morbidity is the incidence of disease. Mortality is the rate of death. So Peggy said for COVID-19, our morbidity is 29,800 cases. That's how many people we know in Arizona have gotten the disease. And our mortality is 1,095. That's how many people we know in Arizona who've unfortunately died from the disease. So vaccines actually help reduce both these numbers. Public health departments and CDC track these for, every disease and even some other, public health kind of conditions or human conditions. But if you're vaccinated, you're less likely to get the disease. And if you don't get the disease, you can't die from the disease, right? Correct. Yes.
Good job.
Every time.
Yes.
So another term that we use a lot is immunization coverage or coverage rates. And what we mean when we say that is the estimated percentage of people who've received a vaccine. So for COVID-19, what's our immunization coverage rate?
0.
Because we have no vaccine. Right.
Yes.
But we know that we have X amount of people who are vaccinated against other diseases, and if you're vaccinated, you're less likely to get the disease.
Therefore, you're less likely to die from the disease.
You cannot die from a disease you don't get.
That is true.
You will die from something else, but not the disease
Correct.
you do not get. So, and the third term is herd immunity or community immunity. Now, we say this a lot. The definition on your screen here is what CDC says. On their vaccine glossary, which is really cool to look at. You should Google it. They define all sorts of terms we use in our vaccine world. So herd immunity is a situation in which a sufficient proportion of a population is immune to an infectious disease through vaccination and or prior illness. So if you get the disease, you actually have some immunity for some diseases. And that immunity makes it spread from person to person more unlikely. Even individuals not vaccinated, like newborns and those with chronic illnesses, are offered some protection. So that's herd immunity. That's me reading off a screen, which I always hate reading off of a screen. So we found this video from a science teacher turned educational consultant. His name's Paul Anderson. And we are going to play that because we think it does a better job of describing this concept.
Most people are familiar with vaccines and how they offer individual immunity against a disease, but they might not understand how the people around us or our herd offers immunity to everyone in the herd. A herd is a group of mammals that are living together for protection, maybe protection against lions in Africa or wolves in North America. But how does that apply to humans and disease? Well, let me show you a little model I put together. So we have these individuals in a herd, and let's say one of them gets sick, and the infection rate of this disease is 50%. There's a 50% chance you could pass that on to another individual. So this person is in close contact with 1, 2, 3 individuals, and so I simply flipped a coin. Heads, you get sick, tails, you don't, and 2 of the people got sick. I then took those individuals and flipped coins for the people around them, and this person, for example, infected 1 individual, and this person infected 2. And then I just kept doing that over and over and over, and you can see how the disease spread through the population. Now, how quickly a disease spreads through a population is based on how many people you can infect, and we call this the basic reproduction number. What is that? Well, for this individual, they infected 2. This person infected 1, this person infected 2, this person infected 0, and if I take a number of those individuals and find their average, that's going to be my basic reproduction number, or R0. If R0 is ever less than 1, in other words, you can infect at least 1 other person, then the disease dies out. But if you've ever heard of a disease, that means its R0 value is going to be greater than 1. And here's some R0 values for some diseases you might be familiar with. So the recent outbreak of Ebola, R0 value 1.5 to 2.5, smallpox 5 to 7, but some diseases like measles and whooping cough, the R0 value might be as great as 18. That's because it's an airborne transmission. And so what happens after you get a disease? Well, you get sick, and in some diseases you might even die. But if you know anything about animals, we can gain immunity to that disease. Once we've got the disease, we're not going to get the same disease again unless it mutates highly. And so what these people with immunity do is they offer protection to everyone else within the herd. So let's see that disease comes in again and it starts to spread through a certain part of the population. Well, the rest of the population can't get it because these people with immunity offer a fire break or a firewall against that disease spreading into the population. And so once our herd gets large enough like this, even though a lot of people don't have individual immunity, they have herd immunity. So let's say a person like this comes in who's sick, they're surrounded by so many individuals who are immune that the disease can't spread to those who are susceptible. And so the problem with this is you have to get sick, or you have to have members of your population die for you to get this herd immunity. But science has come up with a solution to that. It's called the vaccine. We give you a weakened or a dead version of that disease, and then you can gain immunity to it. And so that's wonderful. And you might think, let's go back to that model again. Let's simply vaccinate everybody. If we vaccinate everybody, everybody has immunity. But we can't vaccinate everybody because it's a voluntary process to get vaccinated. Some people don't want to. You shouldn't get like a measles vaccine if you're a baby or you're a pregnant female. And then as you get older, you may lose some of this immunity. So not everybody can be vaccinated. It just simply doesn't work that way. And so what scientists have come up with is a herd immunity threshold. What does that mean? It's how good is good enough? What percent of our population do we have to have vaccinated or immune to the disease so we all get this herd immunity? Well, it's going to depend on the R0 value of the disease. So if it's something like mumps with an R0 value of 4 to 7, we have to have at least 75 to 86% of the population who is immune so the whole herd can gain immunity. But as those R0 values get greater and greater and greater, like 18 in measles, we have to have 94% of the individuals immune. And so as people decide not to get vaccinated, what's going to happen? We lose that herd immunity and we're going to have outbreaks of disease. So if you live on the plains of Africa, you're protected in a herd against a predator like a lion, but who is the lion that's stalking us? It's the disease, which is hiding in other individuals around us, but we also now have to worry about the individuals around us. Are they immune? Are they vaccinated? If not, they're not only putting themselves at risk, but they're putting the whole herd at risk.
All right. I really like that video. We're always looking for new videos, so go ahead and chat in some of those too if you have some of your favorites. But when we watch, Macrina and I watch a lot of these videos. We also email each other a lot of vaccine memes. Like every day, probably we find something that makes us smile. Mm-hmm. So But she reminded me when we watched this about how herd immunity prevented an outbreak last year when we got done tips.
Oh, yeah. So at the end of TIPS, after traveling to beautiful northern Arizona where it was nice and cool, I come back home to Maricopa County, 120 degrees, and a measles case. We had a huge hip-hop competition down in the South Phoenix area, and it was international travel, and somebody came, and she had measles at the time. She was competing, and of course she was a teenager, so what did? They went to the mall a couple of times, they went to the movies a couple of times, they went out to eat, competed frequently in an arena full of people with teams from all over the world, and ended up at the airport, which is always our nightmare everybody's nightmare for measles, because what happens at an airport? People get on a plane and go someplace else. That's a really efficient way to spread disease.
But why? Because before, when we had measles outbreaks after the Mickey Mouse one, we had a lot of cases. So why didn't we have cases?
Well, we didn't have cases because, well, we do what public health always does. We jump on it, and we ask that teenager where she went every single minute of the day. We notify people that if you were in the mall or at this movie or at this restaurant or at the airport between certain hours that you may have been exposed. We told them to watch for disease. If they got sick, to stay at home, call their doctor. You know what the good news was? We kept our fingers crossed, and there was no spread of measles.
And where?
This was in the South Phoenix area. So their immunization coverage was great.
I know, that's what I think is so cool, that community, those of you in South Phoenix rock it.
Right.
And you immunize a lot of kids.
Yeah, and the immunization coverage was great. We've talked about that. And we had great community immunity. And we know that not 100% of folks were immunized. We know that. We'll never get to 100%. But enough folks were immunized that those who could not be immunized for either medical conditions or age, were protected because everybody around them was immunized.
Right.
So I think that's a really good example of how community immunity works and how it protects everybody.
Yeah. Plus, we get to plug in Mountain Park, who's in South Phoenix, who just got 25 years of Cloud Awards from Taffy, which is like, yay, Mountain Park.
We've been at this 25 years?
25 years they did. They got, Taffy gives these Cloud Awards every year for practices that have coverage rates of 90% or above for 2-year-olds or teens, and they've gotten it 25 years in a row. So that's who I would like to give credit for not having a measles outbreak, is the and the other providers.
All the providers in that area who kept up with immunizing kiddos and making sure they were protected, you protected the community as a whole. Not to mention you probably protected all of Maricopa County, all of Arizona, and probably all of the United States, because folks would have traveled all over. So,
Yay. So we're going to look at our rates and see how we're doing on herd immunity levels in Arizona. And my disclaimer is that this is old data. So for those of you who were here last year, we haven't gotten our new vaccine coverage data because all of those folks who work on that are busy with COVID-19. But we will be just as excited when we present this data. So we're going to start with our babies and our toddlers. So this graph here shows all the states and territories. Arizona's in the bottom quarter there for the 2-year-old series, for that whole series. And this is from CDC's National Immunization Survey data. So this slide, though, breaks that down. So that 67%, which is what our coverage rates were for the whole series, is on the far right of this slide here. But we can see here each disease and what our coverage rates are for kids 19 to 35 months. So we'd love for you to chat in what jumps out at you. You know, what surprises you when you look at this? So go ahead and chat in some stuff. DTaP. So Christina Jones, so we need to write down we'll send you a prize because you're the first one who answered that question. We'll send you a prize before our next one. So DTaP is, that's not as high as we'd like it. We just saw in that video that the coverage, we needed much higher coverage, herd immunity levels for that. One of the ones that jumps out to me is, and to Kate Shea, who's also chatting in, is Hep A. So remind us about Hep A, Macrina. Well, that's Macrina's favorite disease.
Oh, yeah, so it's not my favorite disease. I don't have a favorite disease. I have a favorite vaccine, and it's hepatitis A. And I've got some cool stories about that. Hepatitis A it's so easy for kiddos to catch because it's fecal oral. And any of you who've ever been in a child care facility or a person with Head Start who's in the health and safety field, you probably know with those facilities, kids play, they have their hands everywhere. And so it's an easy place to spread disease. So 63% kind of scares me because within child care facilities where it's required, it's pretty close contact.
So what are the symptoms again?
Well, with hepatitis A with children, you really don't get any symptoms. If you do, they're very mild. They're maybe diarrhea, a little fussy, but usually not anything severe. Where we start to see severe disease is when those babies take that hepatitis A home to either grandparents or parents who are more likely to have severe symptoms or more symptoms because they're assisting with toileting and changing diapers.
So we had a big Hep A. Those of you who came to our TIPS training last year, you'll remember Monica, who works with Macrina. She's another nurse, and she was running around with a chicken and no head because they were working on a Hep A outbreak. So these are those numbers. That Hep A outbreak is still, there is still Hep A circulating in our community. This was pulled from ADHS's website last week. We have 598 cases right now. But tell us your favorite story of how we went from the most number of cases for Hep A in the country, Maricopa County did, to the least. What happened?
This is why it's my favorite vaccine.
And you have to tell it fast.
Okay, this is why it's my favorite vaccine. We had a huge hepatitis A outbreak among children in child care centers. We discovered that if you worked in a child care facility or attended a child care facility, you were 6 times more at risk for getting Hep A. And if you were a household contact, grandma, grandpa, sibling, mom, dad, you were 3 times more likely to get hepatitis A. So we decided that we were going to go rogue because we had done all the work we needed about how to change diapers, how to clean, washing hands. And so we decided to go rogue and say, why not? Let's try to institute a hepatitis A vaccine requirement, and that should help. So what we did was we went to the state legislature. We said, look at these numbers. We don't want to be #1 in Hep A anymore. We'd like to get to the bottom of the list. So we instituted an emergency rule, which became permanent in 1998. Where we required vaccination with hepatitis A to attend child care, Head Start, preschool, any under K program. And you see within a year that those cases dropped dramatically. And they continue to drop over time. This is why this is my favorite vaccine, because all it does is show that vaccine works. It stops disease. This vaccine is incredible. With 1 dose, you get incredible protection, like 99% for years. And then you get that second dose, and you're good for a lifetime. I love it.
Okay.
Okay, I'm done.
All right. And we love seeing your chats. We'll have to figure out a way to kind of summarize all of these so that you all can see what jumps out at other people too. But let's move on to our kindergartners with their frozen backpacks and their little name tags with their teacher's name around their necks. So the National Immunization Survey, so the same data set that we looked at for those babies and toddlers, they do have numbers on kindergartners too. But there's another data set that we like to look at a lot, and that is the percent of kids who have personal belief exemptions. So every state has requirements for immunizations for school entry. And in Arizona, parents do have the right to exempt for personal belief reasons and exempt from those vaccines. And it's something that we track here in the state. Now, ADHS, if you go to ADHS's website, and we'll email you the exact links after the session, you can find these phenomenal maps that show the percent of kindergartners and 6th graders that are exempt from vaccines in your county. And for our 2 larger metro areas, Tucson and Phoenix, we can look at in our actual neighborhoods, closer to our neighborhoods too. Having this data available from ADHS has been a huge game changer because parents we can look up individual schools. When you go to ADHS's website, you can look up your child's school, you can look up your niece's school. A lot of you remember Donna Furlong, who worked at Coconino County. She used to come with us to all the cool cities to Page, cool as in
Like cool and
temperature.
temperature.
Oh, they are cool. They're my favorites, the north ones. Sholo and Page and Prescott. Well, she moved down to the valley in the last few years and works for Banner Health now, but she looked up her grandson's school on ADHS's website, was floored by the number of children who were exempt from vaccines, met with the school nurse, and that school nurse, Elizabeth Mason, took it upon herself to tackle the problem. She educated the leadership about these diseases, about the impact of exemptions. If a family does submit an exemption for a child, what happens in the event of an outbreak, that they can't come back to school. And she really focused all of her process changes on making sure that families who did truly want to make that choice and did consult with their child's pediatrician or healthcare provider still are able to make that choice, obviously. But for families who really just hadn't had the information yet and just needed somebody to talk to and help answer questions, that there were systems in place to do that. So TAPI awarded Elizabeth with the Andy Denius Hotshot Award this year. Andy is a friend and mentor to many of us in vaccines. So having this data has been a game changer. And exemption rates drive coverage rates. So we know that these immunization requirements for school entry actually help to improve the immunization coverage, because it's a system that just gets parents in your door, and they also get physical exams and everything else. Go for it.
So, okay, so the previous slide, I want you all, if you have time, to go back, and when we send you the link, look at that, because think about that hip-hop teenage dancer. If she had been in another community, or if she had been in another part of Maricopa County, or in your community somewhere, would measles have spread or would it not have spread? And I think that's, when you think that story and look at your exemption rate data, then it kind of really shows what risk some communities are at.
Thanks.
You're welcome.
So our exemptions are increasing, which, we are concerned about. This slide, and we'll send this afterwards, shows what our rates were in 2005 and then what they were the last 2 years that we have data for. So we know that this is something that's increasing, and why you work so hard every day to give families all the information and educate them to answer their questions. When you look at measles specifically, and Macrina's talked about measles a little bit, this chart on the left here shows the percent of schools that have community immunity, that reach herd immunity levels for sixth graders. So we're looking at sixth graders now. So I'm going to Gila County tomorrow. I'm going camping. So in Gila County, where I'm driving through, Peggy, I'm taking off tomorrow, by the way. 27.3% of schools have community immunity. Of sixth grade classrooms have community immunity. That means almost 70% of children in Gila County are sitting in sixth grade classrooms where most of the children where they don't have those levels, they haven't reached that 95% coverage level. When we're talking about exemptions, we're talking about 8,150 kids in Arizona that are exempt from every vaccine. So it's a really good indicator, because we know that it's going to help drive immunization coverage rates, which then drives herd immunity levels, because one way we get immunity is through immunizations. And this is my favorite slide in the world, because it shows that in, what year was this? 1958, we had about 775,000 cases. 775,000 cases. That's like unfathomable to me. Yeah. We're freaking out about 20,000 COVID cases. I mean, this is a huge number of people who have measles.
There were less people then.
And this drop is because the vaccine came to the market, but that really big drop that happens in the 60s there is when we started requiring measles vaccines for school entry. So again, really a good thing that helps promote herd immunity. So let's move on to teens. Teens have 3 really important vaccines. We hate picking a favorite vaccine when it comes to teens, but we did want to talk about pertussis. So our rates for teens are also, for Tdap and MCV are not increasing right now. If we just look at the last 3 years, and again, this is a also still a bit dated. But remind us what pertussis is and symptoms, treatment, remind us of the pertussis.
Well, okay, so pertussis is whooping cough. And where we're really concerned about pertussis is really with our young babies and our, so why we really want to make sure that these adolescents are protected. Not only do we want to protect them from pertussis itself, but we want to protect those young kids around them as well. We see cases of pertussis in adolescents quite a bit. We see pertussis in adults. We don't see it as easily diagnosed in adults or teenagers because it can be a chronic cough that can last a long time. They routinely make multiple trips to the doctor's office, try multiple inhalers and antibiotics that don't treat pertussis, and then by the time they actually identify this pertussis and treat pertussis, then they've been out spreading. Monica, who did TIPS last year, some of you who've been to would remember her, she actually had been treated by multiple physicians for multiple months, only to be diagnosed by an ED doc when she went to the emergency department, and they took an x-ray and discovered she had 2 broken ribs. And the ED doc says, oh, you have pertussis. So that is why we're so passionate on making sure that those adolescents get pertussis vaccine. We're also passionate, can I bring this up now? We're also passionate on getting those moms in that 3rd trimester of pregnancy immunized with Tdap, because the only way to make sure those little itty-bitty babies that come home are protected is so that they get a little bit of antibody from mom at birth. That helps protect them. If we could get every single mom immunized in the 3rd trimester and every single baby was born with a little protection, we could actually wipe out severe disease among those babies. So that is probably one of the most powerful tools we have to keep babies safe from pertussis.
So my friend's 5-week-old preemie got pertussis from his 6th grade, or his school-aged brother who was vaccinated. So why did that happen if he was vaccinated?
So pertussis is not the perfect vaccine. It provides protection. It starts to wane pretty quickly. So that's why it happened.
Okay.
And the more people in the household who are immune, the better off it is.
Okay.
Yeah.
Yeah, it's that we talk in pertussis. We talk a lot about cocooning.
Yeah, and even if you're vaccinated and you have the symptoms of pertussis, you always need to think about that they may have pertussis.
Well, and I think right now when we talk a lot about cocooning and making sure we want pregnant mom immunized, but we also want the other people who are going to be in close contact with that baby immunized. And right now, while we're all staying home with our families so often, that is a really important message to make sure those pregnant moms that you know have, so that they're aware of.
Right.
I love that folks are chatting in how there's lots of questions on here, but a lot of people are chatting in what jumps out to them is HPV, and that jumps out to us too.
Yeah.
And this is like incredible. You are curing cancer. Every time you convince a family to get an HPV vaccine for their child, every time you convince an adult who's 45 and under who can get HPV vaccine to do that, you are preventing cancer. You're preventing cancer. And we have made such major strides in this HPV, this fight to protect our community from HPV. So you need to applaud yourselves a lot more.
And that is amazing to me that over years doing TIPS, we have talked about HPV over and over and over again, and we've problem solved. And I've learned a lot from you, and you've learned from us. And it's just amazing that all that work we've done over the years trying to problem solve this and how do we talk to parents, it's actually working.
Yep. It is. You're doing good. So, Chris, can you launch that poll about who their practice immunizes? It's hard for us to get, this is the number poll, or, okay, one thing I have to do better is know. Okay, there it is. So, one of the things about adults is that it's really hard for us to get our hands on data for adults, but there are over 8 million records of adult immunizations in ACES. So when you have a grown-up in front of you, because you immunize grown-ups, please look in ACES to look at their vaccine history. And another thing that we'd love for you all to do is just go back to your offices and say, hey, does our EMR, do we also transfer the information for adult immunizations into ACES? Because we really want that to happen. So the best data that we have for adults is for you, for healthcare workers, and about flu. And this slide shows that healthcare workers who work in hospital settings have the highest immunization rates for flu. Long-term care is the lowest, and our ambulatory care settings are kind of right there in the middle, and that's who mostly is on this call. But we also want to make sure that you know that when you look at this by occupation, physicians have the highest rates, not surprising. But the lowest rates of flu immunization are medical assistants, and we want you protected from flu. So please make sure you do that and talk to us. Reach out to us and let us know why you think that might be happening, because we're always interested. And we only have 2 minutes. Oh, most of you are immunizing both pediatrics and adults, which is fabulous. That's fabulous. We are going to talk quite a bit about flu during the next few sessions. We'd love for you we are really going to need to get flu shots into arms. The stakes have really never been higher for us than they are this year. So maybe next month or the next session or the session after, you can talk about what you're planning in Maricopa County, and we can reach out to the other counties to find out what they're doing. We're going to be doing mass flu immunizations.
We really need to go back and think about what is your organization doing for flu vaccination, because keep in mind, we're going to have 2 diseases this year circulating at the same time. We're going to have COVID and we're going to have flu. And so it's going to be really important that the more flu vaccine we can get out there to everybody, that means the less chances they could get 2 viruses this season.
Right.
So let's try to protect them from the one we have a vaccine for. Yeah. So I know we're working already on big plans. So what are your offices doing to plan for getting all of your patients and clients immunized?
Yeah, we definitely want to do that. I'm seeing a lot of chats about how happy everyone is that they're preventing cancer. So this is the first of a 5-part series. Our next session is June 24th. Please, right after this, you're going to automatically go to our evaluation, and we will also email you that too. We do have prizes. So I said that I would send some already today, and we will send more for folks who participate in all 5 of our sessions and fill out the evaluation. So we are so glad you joined us. It's right at 1 o'clock. Go back to your offices and take care of those patients. Thanks.
Save lives.
Yep. Thanks for what you do.
Thanks.
Yeah. Bye-bye.
Bye.
Thank you. That was fantastic.
There are so many